have a discussion on the non-communicable diseases. So until now we have had a discussion on various kinds of communicable diseases, the kinds of diseases that will spread from a patient to a healthy person, and there would be various kinds of causative agents behind it. There would be various kinds of pathogens behind it, and they can spread the disease via direct methods or indirect methods, correct? But these are communicable, meaning that they can spread from one person to another. Now when we talk about the non-communicable diseases are the ones which will not spread from a diseased person to a healthy person. If you are breathing in the same room, if you meet that person, if you are staying with that person, it does not mean that the disease will spread from the patient to the healthy person. So this will not happen in case of non-communicable diseases, and that's why the name non-communicable. Now when we talk about non-communicable diseases, one thing that you need to know is that when we talk about the leading causes of deaths worldwide, or rather leading causes of premature deaths worldwide, then in that case you will see that non-communicable diseases actually account for more than 70% of premature deaths. By premature we mean the deaths that happen below the age of 70 years. So if the deaths are happening below the age of 70 years, we would in medical terms call it as premature deaths. So if you look at the leading causes of premature deaths, you will find that in large numbers non-communicable diseases actually kill people annually. So as I said, more than 70% of people annually will die due to non-communicable diseases. What are these kind of non-communicable diseases? If I start naming the leading causes, you have the cardiovascular diseases, then you have cancer, then you have respiratory diseases, and then diabetes. Now if you just talk about the numbers, in terms of numbers, the recent data of WHO shows that at least 17.9 million deaths annually are attributed to cardiovascular diseases. When we talk about cancer, the number is 9.3 million. Similarly, when you talk about the respiratory diseases, for example, asthma, etc., in that case we see that they account for almost 4.1 million, and diabetes accounts for almost 1.5 million deaths annually. So that's why these four actually are the leading causes of premature deaths worldwide, and all these are non-communicable diseases. Not only this, if you talk about the risk factors, there are two kinds of risk factors. What are these? The first one can be called as modifiable behavioral risk factors, and the second one can be called as metabolic risk factors. Now when we talk about these two, what do we mean by modifiable behavioral risk factors and what do we mean by metabolic risk factors? So when we talk about the modifiable risk factors, what we are basically talking about are things like tobacco, excess salt, or which leads to basically excess sodium, alcohol, and lack of physical activities. So these basically come under the modifiable behavioral risk factors. Now in this case what happens is, even if you talk about in terms of numbers, what WHO number says is that if you talk about tobacco, the number of deaths that happen because of tobacco annually, according to recent data, it accounts for 7.2 million deaths. Then in terms of excess salt or sodium, we see that it accounts for almost 4.1 million deaths, alcohol 3.3 million, and lack of physical activities 1.6 million. So these are the numbers. Now in case of, and if we talk about the metabolic risk factors, what are the risk factors? One, high blood pressure. Second, obesity. Third is hyperglycemia, which basically is excess of sugar or excess of glucose. And then after that you have hyperlipidemia, which is excess of fats. So when we talk about the metabolic risk factors, these are the primary four risk factors that can come under metabolic risk factors. So these are all the risk factors that can lead to one kind of non-communicable disease or the other. So that's why we have to make sure that all these are not actually adding to the issues. Because most of these, when we talk about the non-communicable diseases, most of these diseases actually are said to be lifestyle diseases. They are called as lifestyle diseases because your living habit, your eating habit, your day-to-day activities, each and everything that you do, if these habits are not good, if these habits are not healthy, then in that case it can lead to one of the non-communicable diseases or the other. So there are a lot of these things that we have to maintain. We need to maintain a healthy living lifestyle, whether in terms of diet, whether in terms of mental health, whether in terms of physical activities. We need to make sure that we are maintaining a healthy lifestyle, because just maintaining a healthy disciplined lifestyle would mean that we can actually take care of a lot of these diseases. A lot of these diseases are directly related to our lifestyle. That's why many of these non-communicable diseases also are called as lifestyle diseases. Alright, so that's why these are some of the basic data that you need to remember when it comes to non-communicable diseases. Now let's have a look at different kinds of non-communicable diseases one by one, starting with the first one, which is diabetes. Now when we talk about diabetes, diabetes would happen in an individual when the pancreas do not produce enough of insulin. Alright, and it is a kind of chronic disease. What is the meaning of a chronic disease? We had discussed about this. Chronic is any disease that takes a long time to develop. Alright, chronic is any disease that would remain for a long time, that will remain or rather persist for long durations. So mostly we say that if it is going to take more than 6 months of time, then in that case we can call it as chronic. So the pancreas do not produce enough of insulin. That is one of the cases where diabetes can happen. Or the second case could be that the body cannot effectively use the insulin that it produces. So either the insulin is not being produced by the body, or the body is not able to use the insulin even if it is being produced by the body. In these two cases, there are chances that diabetes may occur in an individual. Now there are different kinds of diabetes. When we discuss about diabetes, there are three types of diabetes: type 1, type 2 and then gestational diabetes. So what is the meaning of type 1, type 2 and gestational diabetes? Let's try to understand that. So first of all, when we talk about type 1 diabetes is something that is usually seen in young adults or in children. But a very small number of people will get this disease. Not more than 5% of entire diabetes cases are type 1 diabetes. So approximately just 5 to 10% of the people have type 1 diabetes, usually diagnosed in children, teens and young adults, caused by an autoimmune reaction. What is the meaning of autoimmune reaction? Autoimmune reaction is when our body responds to something internally, meaning that normally the immune system is supposed to fight something which is foreign, fight something which can be harmful for the body. But many a times what happens is that the immune system responds to something which is a normal physical process of the body. And in this case, we say that this is an autoimmune response. So, autoimmune reaction is that the body attacks itself by mistake, or rather one of the processes of the body is getting attacked by the immune system. So in this case, what happens is that in case of type 1 diabetes, our immune system stops the production of insulin in the body. And this leads to type 1 diabetes in children or maybe in young adults and teens. So if you talk about the symptoms of type 1 diabetes, excess excretion of urine, thirst, which is also called as polydipsia, then constant hunger, weight loss, vision changes and fatigue. All these can be some of the leading symptoms of type 1 diabetes. If you talk about prevention, one preventive measure would be to use insulin injections, and second would be to maintain a good diet, a healthy diet, and a diet which is according to the disease that is observed in the patient. Apart from that, exercise or physical activities also help in containing type 1 diabetes. After that, you have type 2 diabetes. So in case of type 2 diabetes, this is the most common form of diabetes. This is the kind of diabetes which will be observed in 90 to 95% of the cases of diabetes. So this is where the first two conditions that we had talked about, that either the insulin production does not happen in the body, or even if it does, the body is not able to use it. In these cases, type 2 diabetes will develop. Now type 2 diabetes develops generally in the later phase of one's life, that you will not see this kind of a disease or this kind of a diabetes in children or in young adults, but rather you will see this in people who are older. But the causes of the disease might have set in early. That for some time. For example, for some people it might have taken some 10-15 years of time for diabetes to set in, and ultimately it would start to show up the symptoms maybe in their later 40s or in 50s or in 60s. Alright, so develops over many years and usually is diagnosed in adults. If you talk about the symptoms of type 2 diabetes, increased thirst, frequent urination, hunger, fatigue and blurred vision, all these are some of the symptoms for type 2 diabetes. If you talk about prevention and cure, prevention again has to be, first, insulin injection might have to be taken at a regular basis, so that whatever insulin is not being produced by the body, that can be compensated for. And second, maintaining a very healthy lifestyle, maintaining healthy diet and exercising or doing physical activities regularly. This is the second measure that has to be taken for somebody who has been diagnosed with type 2 diabetes. Then after that you have gestational diabetes. So in case of gestational diabetes, it is something that we observe in pregnant women who have never had diabetes, and if in case gestational diabetes is seen in pregnant mothers, then in that case we have to take extra precaution and extra care of the child who is about to be born as well, because there are chances that the child will also develop some health complications, and in these children whose mother would have had gestational diabetes, that is diabetes during pregnancy, in these children the chances of developing type 2 diabetes in the later half of their life is always higher. So that's why extra precaution have to be taken for these kind of children in case of gestational diabetes. Now if you talk about the symptoms, normally symptoms are not really seen in gestational diabetes. Only through blood test it may show up that gestational diabetes is there in a particular pregnant woman. And this is a type of diabetes which also goes away after childbirth. So that's why it only remains during the pregnancy period and after that it goes away. So that's why you can say that it is asymptomatic. And the only way to know that this kind of diabetes has developed in a woman is through blood sugar test during pregnancy. So usually goes after the baby is born. Increased risk of type 2 diabetes in later life is also seen for the child as well as for the mother, both for the mother and the child. Now after this we move to another set of non-communicable diseases which are called as cardiovascular diseases. So cardio basically is associated with the heart and vascular with the blood vessels. So that's why we are saying that this is a kind of disease, or this is a bunch of diseases which are being caused which are either harming the heart or are harming the blood vessels. So that's why these are called as cardiovascular diseases. Now there are many types of cardiovascular diseases. For example, you have coronary heart disease, where this is the disease of the blood vessels which are supplying the heart muscle. Then after that you have cerebrovascular disease. So cerebro is something which is always related to the brain. So this is a disease which is associated with the brain. Then you have peripheral arterial disease, which is disease of the blood vessels which are supplying the arms and the legs. Then after that you also have rheumatic heart diseases which are caused by the damage to the heart muscles and heart valves from rheumatic fever caused by streptococcal bacteria. Then after that you have congenital heart disease. So congenital is a term that we have already learned, something that is present through the birth itself. So there could be some kind of deformity in the heart or the shape of the heart since the time of the birth, which also can lead to one kind of a disease or the other. So that's why this is called as congenital heart disease. So malformations of the heart structure existing at birth. And then after that you have deep vein thrombosis and pulmonary embolism. So this is blood clots in the leg veins which can actually move to the heart and the lungs. So these are 6 categories of cardiovascular diseases. So just remember the names. You might not be asked the details about each one of them, but in case, let's say if a prelims question has to come, what they can do is they can list out 2 or 3 of these diseases and they can ask you which of the above can be said to be cardiovascular diseases. So that's why these names you should know, and you should just know just one line about this, that what exactly is this disease. Otherwise you do not need to go into the details of each and every one of these diseases. Now if you talk about the common causes of the cardiovascular diseases, Just remember that in most of the cases of all the non-communicable diseases that we are about to see, in most of the cases you will see that the preventive measures are going to be very similar, because as we had discussed that most of these diseases are called as lifestyle disease. So that's why maintaining a healthy lifestyle is what you need to make sure that you can keep these kind of diseases at bay. So high blood pressure can be one of the causes, high cholesterol, smoking, diabetes, all these can lead to different kinds of cardiovascular diseases. Apart from that, there are other causes as well. For example, obesity or overweight can be one of the causes. Inactivity, that is lack of physical activities, can also lead to complications. Family history, and this is very very important, that this is something that can also be genetic. This is a disease that can be genetic. That's why many a times it is seen that, for example, in case of diabetes, it is observed that in many a cases, if there is a family history of diabetes, there are chances that even the child can develop diabetes in the later half of their life. Then other factors like age, gender, diet and alcohol consumption also matter. So that's why many a times, for example, there are certain diseases which are called as degenerative diseases. So degenerative diseases will happen through age, correct? After a point in time, the organs will not be as functional as they used to be, and that can also lead to many of the non-communicable diseases. Then next we have to talk about another risk factor, that is hypertension or high blood pressure. So what do we mean by high blood pressure? We are talking about persistently high pressure in the blood vessels, increased rate of heart, brain, kidney and other diseases, and this is one of the leading causes of premature deaths. We had discussed about this, that among the metabolic risk factors, the highest contributor is hypertension or high blood pressure. So what are the symptoms that we observe with high blood pressure? One, early morning headaches, nosebleeds, irregular heart rhythms, buzzing in the ears and vision changes. All these are different symptoms that can give you a hint that it could be related to high blood pressure or hypertension. Now, apart from that, if you talk about the symptoms, first of all, it can cause persistent chest pain, can lead to heart attacks, can lead to heart failure and an irregular heartbeat, which can lead to a sudden death of the person as well. Then severe forms may exhibit fatigue, nausea, vomiting, confusion, anxiety, chest pain and muscle tremors, and then also it can cause strokes by blocking or bursting arteries that supply blood and oxygen to the brain, as well as it can cause kidney damage, which can lead to kidney failure. So all these kind of diseases can happen, and that's why we talk about hypertension as a risk factor. More than a disease in itself, we look at hypertension as a risk factor, which can lead to different kinds of non-communicable diseases. It can lead to heart failure, it can lead to kidney failure, it can lead to brain stroke, it can lead to so many of different types of non-communicable diseases. That's why hypertension is seen rather as a metabolic risk factor rather than a disease in itself. If you talk about the preventive measures, first of all, daily exercise and relaxed lifestyle. Stress becomes a major factor in hypertension. Stress related to job, related to family, related to society, related to anything. Stress can become a major contributor to hypertension. So that's why a relaxed lifestyle, daily exercise is recommended for everyone. Low fat diet, optimum body weight, doctor prescribed medications, and cessation of tobacco use and the harmful use of alcohol. Reducing consumption of tobacco and alcohol also becomes very very important to make sure that we do not go into the direction where it can lead to hypertension after a point in time. Then after that you have coronary heart diseases. Again, another kind of cardiovascular disease as we had discussed. Now what happens in case of coronary heart diseases is that due to maybe plaques or due to cholesterol, the flow of the blood inside the arteries that may be hindered. So that's why the amount of blood that is required by the heart may not be provided anymore because of these kind of clots that may happen in the blood vessels, and this ultimately can lead to heart failure. Alright, so coronary heart diseases, it happens due to either narrow coronary arteries or plaques and cholesterol builds up in the artery walls, reduced blood flow to the heart due to plaques or due to cholesterol that has deposited in the blood arteries, and clot which obstructs the blood flow. So all these things ultimately can lead to heart failure. So what are the symptoms? Heaviness, tightening at the region of the heart where your heart is, then severe pain in the chest, gasping for breath, intense nausea and vomiting, blood clots may be formed within the blood vessels, and lot of sweating can take place. So all these are some of the symptoms of coronary heart disease, and as soon as somebody sees one of these symptoms, the person has to be rushed to a medical facility or a hospital to get checked for any of the coronary heart disease. So prevention and cure, first of all, cure wise there is no direct cure for coronary heart disease, so that's why we have to take preventive measures. And again, the same things, because this is also a kind of a lifestyle disease, so that's why maintaining healthy lifestyle becomes one of the key factors when it comes to prevention of coronary heart disease. So for diagnosis, ECG or electrocardiogram will be done, and then in severe cases bypass surgery may be required for the patient, so that all the blood clots and everything that is there in the blood vessel, they can be cleaned up. Steps to prevent the coronary heart diseases: maintaining healthy lifestyle, diet low in saturated fat, checking obesity, medication if required, and avoid smoking, alcohol and drugs. So almost the same things as we discussed for high blood pressure as well. And this is what, as I said, that for most of the non-communicable diseases, you'll see that all the preventive measures are actually the same. Now the next thing to discuss is heart failure or heart attack. Now heart failure or heart attack again is something that may happen due to different kinds of risk factors like hypertension, etc. So what happens in case of heart attack or heart failure is that enough of blood is not being supplied to the heart. So that's why the amount of blood that is required for the heart to keep functioning, the heart does not get enough of the blood. And this is basically something that can lead to heart attack. So caused due to blockage of blood flow to the heart muscle. Without blood, tissues loses oxygen and it can die. So symptoms again, tightening or pain in the chest, pain or discomfort in the arms, especially on the left shoulder, because left shoulder is near to the heart, and elbows, jaws or back, fatigue, lightheadedness, and abnormal heartbeat and anxiety. All these are some of the symptoms of heart attack. Now, if you talk about prevention, in case of prevention, first of all, lifestyle changes would be required. Medication may be required as a treatment. Then cardiac rehabilitation is required for some people, especially in severe cases. And stent and bypass surgery may be again required in cases where the things move beyond a point, when they become very, very risky for a person. Then after that you have cerebrovascular accident or stroke, and this is something which is related to the brain. So what happens here is that there is a damage to the brain from interruption of its blood supply. Stroke happens when the blood vessel feeding the brain gets clogged or it bursts. So in this case what happens is that the blood supply, or at least the requirement of the blood that brain has, that is not being supplied properly, and because of that what may happen is that the blood vessels may get clogged or blood vessels may even get burst, and this is where cerebrovascular accident may happen, which may lead to stroke. Alright, so symptoms: trouble in walking, speaking and understanding, blurred vision, double vision, sudden vision loss, or paralysis or numbness of the face, arm or leg. These are some of the symptoms. Why? Because the brain is not able to coordinate well. All these are the activities where there is a huge involvement of the brain, and to coordinate with all these activities, brain is required. And since brain is not being supplied with enough of blood, brain is not able to take care of these kind of activities. So that's why these are some of the symptoms of stroke. Treatment: first, early treatment with medication like EPA can minimize blood damage, and other treatments focus on limiting the complications and preventing additional strokes. Then after this you have osteoporosis as another disease, and this is something that can be called as a degenerative disease. This can be called as a degenerative disease. Now what is the meaning of degenerative disease? These are diseases which actually happen with age. These are diseases which will not be seen in children or young adults, in teens, or even people who are 30-year-olds or 40 years old. So what happens after a point in time is that various organs will start to not function as properly as they used to, and that is where you will see that degenerative diseases may happen, and osteoporosis is one of the degenerative diseases of the bone. Alright, it is related to the bones. So what happens is that the bone density in people who have osteoporosis decreases, and because bone density decreases, they are higher risk of fractures, etc. Even small accidents can lead to their fractures. So these are some of the symptoms that will say that possibly osteoporosis is the cause of these kind of fractures. So the bones become fragile, and elderly men and women are more susceptible because of hormonal changes which occur with advancing age. So what are the symptoms? Symptom wise, there is no clear symptom, but what happens is that even smaller accidents may lead to multiple fractures. That the breakage of bone may not just be a crack in the bone, but rather a complete shattering of the bone. So these are some of the symptoms that will say that the possibility is osteoporosis. So location of the fracture results in varied symptoms. So just remember that the most important symptom would be multiple fractures or maybe severe fractures, which basically leads to shattering of the bones even in minor accidents. Alright, so this is what can be seen as one of the most important symptom of osteoporosis. So fracture of the spine, repeated spine fracture, stress factor, hip fracture, loss of height, all these are some of the symptoms of osteoporosis. If you talk about the treatment, most importantly you need vitamin D and calcium. Why? Because these are most important constituents of the bone. Bone mainly consists of vitamin D and calcium. So that's why vitamin D supplements or calcium supplements have to be given, or maybe in the diet they have to be implemented. We need to make sure that the diet of such people has a lot of calcium or enough of calcium and vitamin D so that they do not fall short. Otherwise the bone density has already decreased. It can lead to various kinds of complications and fractures, etc. may happen.